Most people don't recover from joint pain because they're focused on the wrong things. They wait for the pain to go away, they rest too long, they stretch when they should be strengthening, and they treat the symptoms instead of addressing the system. But joint pain isn't random. It follows predictable patterns. And recovery is not a mystery, it's a process. There are specific principles that determine whether you move forward or stay stuck. And once you understand them, everything begins to change. Hey everyone, Dr. Jeff Peng here. I'm a sports medicine doctor currently practicing in the San Francisco Bay Area, and I've helped thousands of people recover from joint pain without surgery and without medications. In this video, I'm going to walk you through 10 foundational principles that shape every successful recovery. These are the patterns I see in people who actually get better and the mistakes that hold others back. If you're dealing with knee pain or hip pain or shoulder pain or back pain and you feel like you've tried everything, this is the framework that you can finally use to move you forward. Pain doesn't always mean something is broken, but we often treat it like it does, like a red light telling us to stop. In reality, pain is more like a check engine light. It's a signal, not a diagnosis. Sometimes it points to injury, but often it's a reflection of inflammation or the sensitivity of the tissue, not actual damage. The real problem starts when we fear pain and stop moving. That's when the spiral begins. Muscles weaken, joints stiffen, and the pain we were trying to avoid only gets worse. Pain can be protective, but it can also become persistent when the system becomes hypersensitive. So don't let pain alone make your decisions. Movement done safely and intentionally isn't the enemy. It's often the path forward. Pain is not the first sign of arthritis. Weakness often is. But most people don't notice or don't take it seriously until walking starts to hurt. By then, the process is already well underway. The earliest warning signs show up not in the joint, but in the muscles around it, especially the quadriceps. They begin to atrophy. You might feel less stable on your feet. Maybe stairs feel harder than they're used to. Or you find yourself avoiding squatting or getting up from low chairs. These changes are subtle, but they matter because as your muscles weaken, the joint loses its support system. And that's when stress starts to build. Quietly, day after day, eventually pain shows up, but it's not sudden. It's the result of a system that's been deteriorating. So don't wait for pain to be your wake-up call. Pay attention to weakness, instability, and loss of function. That's where arthritis begins, and that's where your opportunity to take control still exists. Rest feels like the right thing to do when you're injured, and in the short term it can be, especially if you're dealing with swelling or acute trauma. But the biggest mistake I see in clinic isn't that people do too much, it's that they stop moving altogether. They assume rest means healing. But what they don't realize is that the body needs load, gradual, intentional movement to recover. Without it, muscles begin to atrophy, joints stiffen, coordination fades, and ironically, the pain they were trying to avoid often lingers longer. Now, I'm not saying you should push through sharp or worsening pain. That's not smart. But complete rest, that can delay recovery and make it harder to return to normal function. Movement is the signal your body uses to repair and rebuild. The key is doing the right kind of movement at the right time and in the right way. So don't make rest your goal. Make recovery your goal, and recovery begins with movement. Walking is great. It's low impact, it's accessible, and it's one of the simplest ways to stay active and mobile. I encourage people to walk all the time. It helps with circulation, joint lubrication, and general health. But if your goal is to build strength, especially in your legs, walking alone just won't cut it. It won't rebuild lost muscle. It won't correct imbalances between your left and right side. And it definitely won't provide enough load to strengthen the joints and tendons that support you. To do that, you need resistance. You need challenge movements like squats, step-ups, and glute bridges. These actually load the muscle. They force your body to adapt, grow stronger, and become more stable. Walking keeps you moving, but strength training keeps you capable. And as you age, that capability becomes everything. It's what keeps you independent. It's It's what prevents falls. It's what lets you keep doing the things that you love. So do both. Walk for health, train for strength. A lot of people avoid strength training because they're worried it'll make their joint pain worse. They think lifting weights will stress their knees, their hips, their shoulders. But when done properly, strength training doesn't damage your joints, it protects them. Strong muscles act like shock absorbers. They take on the stress your joints would otherwise have to handle. They help stabilize the joint. They help guide its movement, and they reduce the wear and tear that builds up over time. On the flip side, when your muscles are weak, your joints are forced to do all the work, and that's when the pain starts. That's when degeneration can accelerate. So the key isn't avoiding movement, it's choosing the right kind of movement. Strength training with good form, appropriate load, and consistency is not dangerous. It's medicine. It's one of the best ways to preserve joint health, prevent injury, and keep your body strong and capable as you age. The best painkiller isn't found in a bottle. It's found in your own body through strength. When your muscles are strong, they stabilize your joints, they protect your tendons, and they reduce the low-grade chronic inflammation that drives so much of the pain we associate with arthritis and overuse injuries. I've seen it again and again in clinic. People who've tried everything, medications, injections, even surgery, and nothing truly worked until they committed to strength training. And it's not just about building big muscles. It's about improving function, resilience, and control. When done properly with the right movements at the right time and with good form, resistance training doesn't just reduce pain, it helps fix the problem that caused it in the first place. So if you're dealing with ongoing aches and pains, especially in your joints, the answer might not be to rest more, it might be to get stronger. One of the biggest mistakes I see during rehab is when people go through the motions without any real focus. They do the exercises, yes, but it's often rushed, it's careless, and it's often just to say that they did it. They think more reps or heavier weights will get them better faster. But that's not how recovery works. Rehab isn't about checking a box. It's about retraining your entire system. Your brain, your muscles, your joints, everything needs to move in harmony again. And that requires intention. It requires slow, controlled, deliberate movement. When you move with purpose, you're reinforcing good mechanics, improving coordination, and building strength exactly where your body needs it the most. When you rush, you're just reinforcing poor patterns. You're not rebuilding, you're repeating. So slow down. Focus on quality over quantity, because true recovery isn't about doing more, it's about doing it right. Most people hear the word mobility and immediately think flexibility, as if being able to touch your toes or sink into a deep stretch is the goal. But that's only part of the picture. True mobility isn't just about how far you can move, it's about how well you can control that movement. It's about owning every inch of your range of motion, not just passively hanging out in a stretch. Can you move your joint without your body compensating somewhere else? Can you maintain stability while moving through a challenging position, especially under load? That's what matters. That's what protects your joints, prevents injuries, and improves how you move day to day. So yes, stretching has its place. But if you want to move better, feel better, and stay active longer, you can't just stretch your way there. You have to strengthen your way into mobility. You don't have to lift heavy weights to build real strength. In fact, if you're dealing with joint pain, recovering from an injury, or simply trying to avoid one, chasing big numbers on a bar can often do more harm than good. What matters far more than the weight itself is how you use it. Moderate weights, used with control, intention, and the right amount of volume, can absolutely build strength, muscle, and stability. The key is progressive overload. That means gradually increasing the challenge over time, not necessarily by going heavier, but by doing more reps, slowing down the tempo, shortening rest periods, or adding another set. Strength is about adaptation, and your body adapts to consistent, intelligent effort, not brute force. Lifting heavy is just one tool in the toolbox, but it's not the only one. And for many people, especially those managing joint issues, it's not even the best one. You can get strong and protect your joints without ever maxing out. Balance training is one of the most underrated forms of exercise, and most people write it off as something only seniors need to worry about. But balance has nothing to do with age. It has everything to do with control. When you improve your balance, you're also training strength, coordination, and stability all at once. You're teaching your body how to respond under pressure, how to stabilize when things get unpredictable, and how to move efficiently without compensation. Whether it's standing on one leg, reaching in multiple directions, or learning how to control your center of mass, these movements train the deep stabilizers that protect your joints and prevent injury. This isn't fluff, it's foundational strength, and it directly impacts how well you walk, climb stairs, get up off the ground, and perform in sports. So if you've been skipping balance work because it seems too simple or not intense enough, think again. It builds far more than you think. Hopefully now you understand how strength, movement, and intention can make or break your recovery from joint pain. But there's another piece to this puzzle, and it becomes even more important as we age. Muscle loss doesn't just happen overnight. It sneaks up slowly, weakening your foundation and making pain, instability, and injury more likely. So if you want to stay strong, mobile, and independent, you need a plan to actively fight age-related muscle loss. In this next video, I'll show you the proven strategies that help preserve muscle mass, prevent decline, and keep you doing the things that you love for years to come.